once again.
Good day, I'm Dr. Evony Lambito Alisa Divesa, and now we will be discussing about anger management. Okay, there are a lot of people who have difficulty controlling their anger, especially if they are overwhelmed with regards to situations that makes them very mad, okay, very angry with people. Okay, so there are a lot actually of ways to handle anger and or to have anger management. So here it is. There are actually myths about anger. So you can express anger whenever and however you wish. That's actually a misconception, okay? You can repress your anger and never have to feel it yourself. Actually, repression is a defense mechanism, but it affects you, your body, and your future decisions. Okay, according to American Psychological Association, anger is an emotional state that varies in intensity from mild irritation to intense fury and rage. It is accompanied by physiological changes such as increase in heart rate, blood pressure, level of the hormones epinephrine and norepinephrine. These are actually, if it's increased, they're part of the stress hormones. Okay, so don't forget this definition of American Psychological Association about anger. Okay, there are another definition for anger. Okay, a powerful emotion that you can harness. Okay, you can actually tame it and make it more or express it in a healthy way. Okay, it's neither inherently bad nor good, judged by its function as it is expressed, often expressed hand me down, the ways you learned, the powerful motivation driver that can be transformational. So that's anger. So it's also a secondary emotion reflecting some unmet expectation or need, especially if we have expectations. Okay, a potential feedback tool that can enhance your understanding of your needs and expectations. It's a double-edged sword. When it is focused on a vision, it can be creative, a constructive change. Okay, when focused on guilt, it creates the indulgence in self-pity and depression. So make it more productive. Okay, use it as a way to focus on your vision. Okay, while hostility is a chronic state of anger and antipathy toward people. Okay, anger is temporary and episodic reaction to a frustrating situation, whereas hostility is a personality characteristics. So hostility is more of violence. Okay, so again, it's a chronic state for hostility, and while anger is temporary, so it can just pass by. Okay, with regards to aggression, it is an intentional desire to harm someone. Okay, it's aggression. So we have patients who are admitted because of this. Rage is when anger explodes into completely irrational behavior and there is loss of control. So that's why I have this video for us to know how to manage it. Okay, so aggression is behavior intended to threaten or injure the victim's security or self-esteem. It means to go, to attack. In psychology, the term aggression refers to a range of behaviors that can result in both physical and psychological harm to oneself, other, or objects in the environment. So these are actually more definition of aggression. Okay, in social psychologists define aggression as behavior that is intended to harm another individual who does not wish to be harmed. Okay, violence is defined as a physical act of force intended to cause harm to a person or an object and to convey the message that the perpetrator's point of view is correct and not the victim's. Okay, that's the difference of aggression and violence. Okay, again, aggression is a verbal statement that are intended to threaten, Okay, aggression and violent behavior represent continuum from suspicious behavior to extreme actions that threaten the safety of others or result in injury or death. Okay, there are actually biological theory for this anger. Okay, current neurobiological research has focused on three of the brain believed to be involved in aggression: the limbic system, the frontal lobe where we decide, hypothalamus. Neurotransmitters also have been suggested, okay, in having a role in expression or suppression of anger or aggressive behavior. So we will deal specifically on this. Okay, for the limbic system, it's amygdala, frontal lobes, and limbic system. It's the stimulation of the amygdala results in augmented aggressive behavior, while lesions of this area greatly reduce one's competitive drive and aggression. Okay, so take note of that, the limbic system. Okay, emotional intelligence also affect or this limbic system. Okay, so again, limbic system, as mentioned a while ago. Okay, part of it is amygdala, and the next one is the frontal lobe. Okay, dysfunctions of frontal lobe alter the neurochemistry and neurometabolism. So impaired function of the prefrontal cortex leads to aggression. Okay, you cannot actually analyze things the consequences of things that you do. Lesions in the frontal cortex are characterized by aggression, irritability, and short tempers, and damage to the frontal lobes can result in impaired judgment, personality changes, problems in decision making, inappropriate conduct, or aggressive outbursts. That's why usually we also let the patient have CT scan if ever it's amenable. Hypothalamus, okay, regulatory role. Okay, the hypothalamus causes aggressive behavior when electrically stimulated, but also has receptors that determine aggression levels, okay, through the neurotransmitters serotonin and vasopressin. Okay, these are actually neurotransmitters that are involved also in aggression. Okay, so take note of that. Okay, stress raises the level of steroids, the hormone secreted by the adrenal glands. Okay, nerve receptors for these hormones become less sensitive in an attempt to compensate, and the hypothalamus tells the pituitary gland to release more steroids. Actually, after repeated stimulation, the system may respond, okay, more vigorously to all provocation. That may be one reason that traumatic stress in childhood may permanently enhance, okay, or there is potential for violence. Okay, there's also testosterone that has been shown to correlate with aggressive behavior. Progesterone, luteinizing hormone, prolactin increase aggression. Estrogen decreases aggression. Progesterone and estrogen in women. Okay, thyroid hormones increases aggression. Serotonin or low serotonin could contribute to aggressive behavior. So alcohol disinhibits an individual, okay, over half of all acts. Okay, so for psychoanalytic theories, Sigmund Freud is well known as the father of psychoanalysis. In his early theory, Freud asserts that human behaviors are motivated by sexual and instinctive drive known as the libido, which is energy derived from the eros or life instinct. Thus, the repression of such libidinal urges, okay, displayed as aggression. Okay, so later Freud added the concept of thanatos or death force to his eros theory of human behavior. Contrary to the libido energy emitted from the eros, okay, thanatos energy encourages destruction and death. Okay, in this conflict between Eros and Thanatos, some of the negative energy of the Thanatos is directed toward others to prevent the self-destruction of the individual. Okay, thus Freud claimed that the displacement, okay, of negative energy of the Thanatos onto others is the basis of aggression. So that's the psychoanalytic theory of Freud. Okay, according to Freud, aggression may be due to impaired mother-child relationship. So children of punitive parents are more aggressive, okay? So be careful, parents, okay, with regards to your parenting. Aggression is developed during the oral stage. When the pleasure of biting is added to that of sucking, fixation on the oral stage of psychosexual development may lead to sadistic personality. So that's with regards to psychoanalytic theory of Freud. Okay, aggression may be due to impaired development of the superego. Okay, superego is our conscience. Okay, aggression may be due to defense mechanisms, projection, narcissism, and repression. So for defense mechanism, I have actually prepared a video for you that entitled Know Thyself, the defense mechanism that we usually use in order to survive problems and any obstacles. Okay. Okay, Lawrence theory, the evolutionary theory of aggression. Lawrence looked at instinctual aggressiveness as a product of evolution. Aggressiveness is beneficial and allows for the survival, territory protection, and success of populations of aggressive species, since the strongest animals would eliminate weaker ones, and over the course of evolution, the result would be a stronger, healthier population. But that's according to the evolutionary theory of aggression by Lawrence. Lawrence. Okay, so that's Lawrence theory. So take note of that as well. So, according to Adler's view, aggression is due to the striving of superiority and perfection, while McDougall's view, aggression is an instinct. A civilized man modifies and replaces physical aggression and destruction with sarcastic smiles, polished, insulting words. Only when these methods fail may the individual regress to the primitive and childish way of behavior. So that's it. Childish and primitive way of behavior if you cannot actually manage your anger. Okay, so take note of that. So humanistic theory states that aggression is a drive, basic concept. Okay, it arises from deprivation of basic needs according to Abraham Maslow. The drive theory attributes aggression to an impulse created by an innate need. In this theory, frustration, aggression are linked in a cause and effect relationship. Frustration is the cause of aggression, and aggression is the cause or the result of frustration. Okay, social learning theory. Albert Bandura and his colleagues were able to demonstrate on the ways in which children learn aggression. So Bandura's theory proposes that learning occurs through observation and interaction with other people. So the experiment involved exposing children to two different adult models, an aggressive model and a non-aggressive model. So usually, children will imitate the adults. So he predicted that children who observed an adult acting aggressively would be likely to act aggressively. Okay, aggression is initially learned from social behavior and maintained by reward, which encourages the further display of aggression. Okay, aggressive responses are acquired, so they are evitable. Okay, so that's with regards to his theory. And media violence. What about this? Although most young people who are exposed to violence in TV, movies, and playing violent video games do not become violent criminals, okay? They can become more open to acts of violence. However, media violence is explicitly not considered a casual influence of aggression, but in combination with genetic and early social influences could have an influence of this. Okay, instrumental aggression, typically during toddlerhoods, aggression aimed at obtaining an object, privilege, or space with no deliberate intent to harm another person. That typically of toddlers, okay? So hostility, okay? Aggression intended to harm another person, such as hitting, kicking, or threatening to beat up someone. So this is actually the kind of aggression that I have mentioned. What's the difference of this? Hostility, okay, it's chronic, okay? So, relational aggression, it is intended to harm others through deliberately manipulation of their social standing and relationships. It is actually a type of bullying, okay? So, this is what we call relational aggression. Okay, another explanation for this is harming others through purposely manipulation and damage of their per relationships or social status. It can be proactive, planned and goal-oriented, and reactive in response to perceived threats, hostility, or anger, okay? So there are actually different kinds of aggression: verbal aggression, physical aggression against others or against property or objects, physical aggression against self. So take note of those kind of aggression. So now we will proceed to modeling. Okay, children model their behavior at a very early age after their primary caregivers, usually parents. Okay, how parents or significant others express anger becomes the child's method of anger expression. So you cannot share emotional quotient if you don't actually have good emotional quotient. Okay, operant conditioning, a positive reinforcement is a response to a specific behavior that is pleasurable or produces the desired results, while negative reinforcement is a response to the specific behavior that prevents an undesirable result from occurring. So anger responses can be learned through operant conditioning. So if you don't want to enhance those behaviors, so you have to have negative reinforcement, not positive or praise that. Neurophysiological disorders. So if there is tumors in the brain, particularly in the areas of the limbic system and the temporal lobes, trauma to the brain resulting cerebral changes and diseases such as encephalitis have also been implicated in the predisposition to aggression and violent behavior. So that's one of the example of organic causes. So biochemical factors, violent behavior may be associated with hormonal dysfunction, with Cushing's disease, or hyperthyroidism. Some research indicates that various neurotransmitters like epinephrine, norepinephrine, dopamine, acetylcholine, and serotonin may play a role in the stimulation and inhibition of aggressive impulses. Okay, some other factors such as socioeconomic factors, an ongoing controversy exists as to whether economic inequality or absolute poverty is most responsible for violent behavior within this subculture. So it's still in controversy. Environmental factors, moderately uncomfortable temperature appears to be associated with the increased aggression, while extreme hot temperatures seem to decrease aggression. A number of epidemiological studies have found a strong evidence between use of alcohol and violent behavior. Other substances, including cocaine, amphetamine, hallucinogens, anabolic steroids, have also been associated with violent behavior. So these are actually the environmental factors. We actually have phases of aggression. So triggering phase, escalation phase, crisis phase, recovery, and then post-crisis phase. So these are actually the phases of aggression. So we will tackle one by one. Okay, for the triggering phase, an event or circumstances in the environment initiates the client's response, which is often anger or hostility. So this is a circumstances where a person is still on a non-threatening manner, which can be managed easily and without any kind of hostility. While escalation phase, the client's response represent escalating behaviors that indicate movement toward a loss of control. Okay, here a man with a very high anger level will result to a pale or flushed face, yelling, agitated. Okay, so crisis phase. During this stage, the man will lose his control and react to the environment by kicking, punching, screaming, throwing objects. Okay, crisis phase. He will have the loss of the ability to communicate clearly because he is actually overwhelmed with the angry emotions. So don't argue with the person who is in crisis phase. So regarding recovery phase, with regards to this phase, as the person regains physical and emotional control, the man is showing more relaxed state by lowering his voice, decreased muscle tension, and has more rational communication with others. So wait for the recovery phase of the person who you are arguing, okay? So the last one is the post-crisis phase. The man will attempt reconciliation for everything he has done. He will be very emotional that they apologize in a quiet yet crying behavior. In here, the man can now be reintegrated to the environment to be more relaxed and emotionally stable. So, post-crisis phase. But don't wait until the post-crisis phase that you have done a lot of things that you cannot actually change. So signs and symptoms of aggression. In triggering phase, restless, anxious, irritable, muscle tension, rapid breathing, perspiration, loud voice. So this is actually in the phase of triggering phase. So there is a stimulus that makes the person angry, okay? So take note of this. Now we will go to the escalation phase, okay? So he becomes pale or flushed face, yelling, agitated, threatening, demanding, clenched fists, hostility, or loss of the ability to solve problems. Yes, of course, you cannot solve problems if you're always angry and you do a lot of things. In crisis phase, loss of emotional and physical control, throwing objects, kicking, hitting, spitting, biting, scratching, screaming, inability to communicate clearly. Don't argue with the person in crisis phase. Remember that. Okay, in recovery phase, lowering of voice, decreased muscle tension. He becomes more clear, rationally. Okay, more rational communication and physical relaxation. Okay, in recovery phase. So in post-crisis phase, there is remorse, ask for forgiveness, apologies, cries, quiet down, withdrawn behavior. But you cannot actually, change things you already have done. So in the management, the goal of anger management is to reduce both the emotional feelings and the physiological arousal that actually anger engenders. Okay, so that's the goal. Okay, reduce both. So aggression, you can actually classify it if it's mild, okay, sarcasm, moderate, slamming doors, there's physical aggression, severe, threats of physical violence against others, extreme, physical acts of violence against others. Okay, aggression may be associated with the following defining characteristics. Okay, I mentioned actually these behaviors in the phases of aggression, okay? The triggering, the escalation, the crisis, the recovery, and the post-crisis phase, okay? There is increase in agitation with overreaction to environment, panic, anxiety, angry mood, okay? So these, again, are symptoms of those phases with crisis and then escalation. Okay, assess for risk factors. Does he have a history of violence? Okay, we do have to diagnose the patient if he or she has a mental disorder. So, and then assess the history of present illness and the current behavior. So we do the mental status examination, observe the patient. We do thorough psychiatric assessment of the patient.
Okay, why is it important that we have to learn about how to manage anger? It's because there are a lot of people who actually have difficulty managing their anger, okay? Managing their anger to the extent that it actually affects their relationship, their work, their functionality at home, at work, or in school. So there are a lot of advantage of being angry, and you cannot actually control it. And if there are times that they want to control it, they have difficulty, expressing the anger, or if they suppress it, it actually makes them feel bad, okay? So, there are actually ways to handle anger, but you should also know what are the effects of anger to our body. So, here it is.
So we have anger styles. Okay, anger out, anger in, expressing anger, assertively healthy anger. Okay. So for again, this take note of this anger styles because it actually have different consequences. So for anger out, anger feelings directed toward other people. Okay, some reasons: no choice, appear powerful, hide other emotions, uncomfortable in close relationships. So these are actually the reasons for the anger out, or if your anger feelings directed towards others. So assaultive, okay, physical, verbal cruelty, rage, slapping, shouting, kicking, hitting, threatening. It's aggression, overly critical, fault finding, name calling, accusing, nagging, whining, sarcasm, prejudice, okay? So these are actually anger out signs. So take note of this anger out signs because it's actually not advisable because it harms other people. So for consequences, possible physical destruction, impairs relationships, compromising physical and mental health, legal ramifications, and heart diseases. If you're always angry toward other people, it actually affects your health. Okay, you have to manage your anger. So for anger in, anger that is directed inwards towards oneself. So there is fear of hurting, fear of being disliked or rejected, fear of losing control, feeling of it's inappropriate to be angry, unable to cope with strong, intense emotion, fear of damaging or losing relationships. So these are the reasons why we anger in. Okay. So, for the signs, withdrawal, quiet remoteness, silence, little communication, guilt, tiredness, anxiety, addictive behavior, and others have depression. Okay, actually, depression is also have anger towards oneself if it's that's rationally behind. So, anger in signs. Okay, take note of this. So there are also consequences: hypertension, anxiety, depression, accident proneness, passive aggressive personality, cynical or hostile behavior, cancer. Okay, so anger in. So stress actually causes physical harm that you cannot even imagine. So it's important. So we have the cycle of anger, underlying feelings of fear, anxiety, vulnerability that trigger a person to do things. Okay, possible repeated triggers, learning to feel anger and control its expression, gaining of self-respect. So if you cannot actually learn to feel it and control it, you have an outburst of rage, loss of your control and self-respect. So that's the cycle of anger.
Okay, so now you understand that there are actually it is actually important that we should know how to handle anger and what is the effect in our body. Okay, so what are the steps that we should learn about anger management? Okay, so please also apply relaxation techniques like breathing meditation. Okay?
There are steps in breaking the cycle of anger. Recognize what our underlying feelings are and to treat ourselves with extra care, okay? To learn how to feel our anger and to focus towards the right place. Okay, so please take note of these two important steps. So how does anger feel? Anger feels uncomfortable. Okay, thumping heart, tightening of throat or chest, indigestion. Okay, weary feeling in the body, headache, feeling of pain in chest, prickling at the back of the head. So it's actually, yes, uncomfortable. So you can actually, recognize those in those different phases of anger. So there's also an indigestion or a hunger. So strategies: don't hit, push, shove, hold, or threaten. Stand up and yell, make faces or make fun of others, swear or call people names, get stuck in the past, say forget it. Okay, interrupt, always have to get the last word and have to win every battle. So don't. That's actually the don'ts. Okay, so know the don'ts in anger management. Okay, so sit down and talk. Stick to one issue at a time. Take time outs before you lose control. Listen to what the other person is saying. Attack problems, not people. Be open to discussion and compromise. Be flexible. Be responsible for what you say and do. State your feelings. Okay, so do this. Okay, this is a strategy to overcome, do anger management. Strategy to control anger: keep your voice low, breathe slowly. Okay, count to 10. 1, 2, 3. Think before you act. Hit a pillow or cushion, throw safe items in a container, walk. Okay, read newspapers, shout in a safe place, pretend to talk to the person who makes you angry. Remember, it is healthy to let anger out in a safe, okay, and healthy way. So rational emotive therapy to control anger situation: you're working on an important document. Okay, beliefs, your first impression. Okay, feelings and actions: you yell at the person who unplugged your computer and blame them for all the work you lost. So that's the situation. Your beliefs, what are your feelings and actions? Okay, so dispute: you start to question your demandingness. Okay, realistic goals: you decide that in the future you'd like to have less risk of having your work interrupted. Okay, do something, solve the problem. Constructive option: you opt for options like moving the computer cord to make it harder to accidentally unplug. Put option into practice: you move the computer cord and you set up your do your programs to autosave every 3 minutes. Okay, so put an option into practice. So assertiveness and anger: there is really only one golden rule: do not express your anger in a way that might harm yourself or others. So speak from your own experience. Use words like I think, I feel, I am angry. Okay, I am angry. I'm experiencing such and such. Okay, recognize it. Okay? Ask for exactly what you want. Say, I would like, is it possible for you? Don't put the blame, okay? Find the true target of your anger, but don't always accuse them of it. Find a safe way of expressing your anger. Okay? Take responsibility for your own life and happiness. If you can practice the above, you will find your anger is much cleaner and less contaminated by other emotions such as vindictiveness, violence, resentment, and fear. Okay, so you'd have to first identify it. I have relaxation techniques discussed with stress management videos I have prepared for you. So aside from this meditation, breathing technique, and muscle relaxation, so please go through my YouTube channel DocVon and watch my other videos about stress management. Okay? Be angry with the right person to the right extent and at the right moment and with the right object and in the right way. That is not easy. Okay, that's according to Aristotle. Angry with the right person to the right extent